Hi, my name is Austin Quebedeaux. I'm a podiatric physician, and I've been with the Community Health Network since 2020. I think that medicine is a really powerful way to help people, but I also think it's a profession that calls us to excellence. Podiatry is different than a lot of different medical specialties in the sense that you're not focusing on a single system of the body, but really you're looking at the foot and ankle. You're focusing on a location. So you really have a depth of your specialty that's unique. You're not just dealing with the heart or the liver. You're dealing with, well, I got to treat the nerves in the foot and the ankle. I got to treat the skin, the bones, the muscle. On top of all that, you're treating a lot of different things, but you also get to interact with patients surgically. That's a really powerful way to help people. It's a really stimulating way to go about treatment as well. My approach to patient care is to let the patient drive that interaction. When I go in and meet that patient for the first time, I want them to lead that conversation. I want them to tell me what they need from me. I want to provide options for them. But at the end of the day, every patient's unique. Patients have different requirements, different demands in their own personal lives. And what's interesting about that is to have a tool set that you can give them options to treat their pain or options to treat their problems, and not just one way, but in several ways. And when you do that, the patients have this opportunity to drive their own care that meets their own demands. And that's what I think is really necessary when interacting with a patient and giving them the care that they deserve. I practice all over the Indianapolis area. We have a clinic in Carmel. We have a clinic in the north side. I do some wound care at Community Hospital East. I'm also in Kokomo. Yeah, it's a lot of fun. You see a lot of different people. You meet a lot of different people. You go to a lot of different towns and experience that town for what it is. And I appreciate that. It's really fun keeping a variety in our job, so I appreciate it. What motivates me is the opportunity to help people. I just think as a medical care provider, obviously that's our number one priority. How can we help people? But when you have that opportunity to be hands-on with a patient, when they leave the clinic feeling better, saying, oh my gosh, that pain's finally gone, there's nothing quite like that, to just know that you've helped something that's really been bothering somebody. That really is a great feeling. Outside of work, I have a wife, I have a baby daughter, growing family. It's my priority when I get home is to, take time to spend with them, and I love that. I grew up in Montana, my wife grew up in Minnesota, so we love outdoors, winter sports. We're always biking all over town on the Monon Trail, so we stay busy, trying to keep active and keep healthy. And my name is Austin Quebedeaux. I'm a podiatric physician, and I've been with the Community Health Network since 2020.